Good morning, good afternoon, good evening, all. This is our 11th seminar. We are very proud of today's seminar because it is related to a call FAPESP is launching on social research society's approaches to the study of how to handle and recover from COVID-19. So it's a very important seminar for the research community, and so that's why we are very glad to have organized it and to have a very distinguished team of scholars with us. But before starting the seminar, I'm just here to first introduce Professor Luiz Eugênio Melo, the scientific director of FAPESP, to whom I pass the screen now. So, Professor Luiz Eugênio Melo, good morning, and the screen is yours.
Thank you, Marta. Good morning, good afternoon, good night to you all, depending on where you are. As already mentioned, we're honored to have this distinguished panel today and to address a topic of scientific collaboration aimed at studying what aspects we could develop in terms of the recovery on the COVID-19. This work stems from the work developed, commissioned by the United Nations, which was the UN Research Roadmap, to which we have participated. And again, given the global nature of the COVID-19 pandemic, we understand that a global cooperation is necessary, and even more so on the research. What we may learn in Brazil may be relevant for people in other countries, and the same applies for what is learned in other countries, which may be relevant for us in Brazil. And again, doing a collaborative research is what we see where we can learn the most. So again, I'm very glad to be here launching this initiative and trying to engage the largest number of researchers around the globe on this effort. Thank you all for participating, and back to you, Marta.
Thanks a lot, Professor Melo. As Professor Melo just said, we understand that this call in the moment we live, we are facing now opens up the opportunity for collaborative research on such a challenge subject as the COVID-19. We have today a very distinguished team of scholars on subjects we understand are key themes on the worldwide research agenda on COVID-19. But before introducing them and passing the screen to our speakers, I would just like to give you some information. First of all, this webinar is being recorded on Agência FAPESP YouTube channel, and it means that it will be available for all after its closure. So right after the seminar, you can watch it again whenever you want. So it will be available. Second, questions about DCAL, the FAPESP call, can be sent to chamada covid2.fapesp.br. So we are not talking about the specific details and requirements of the call in this webinar. indeed, the call and its rules is also available at the FAPESP website. So instead of talking about the detail and the rules of the call, we are going to discuss today the research agenda this call aims at addressing. So for the purpose of discussing this research agenda, we'll have a Q&A section F, the presentations, and questions on this research agenda can be sent either in English or Portuguese to live.fapesp.br and I will receive, and the FAPESP team will receive these questions and address to the our speakers. Unfortunately, two of our speakers won't be available to the discussion because Professor Stephen Hoffman is not able to attend the discussion for research reasons of his agenda. So he sent a video which will be presented in a few minutes. And Professor Alice Norton as well won't be able to stay with us after her presentation again for agenda reasons. But Professor André Brunoni and Professor Ana Maria Almeida will stay with us and will take part in the Q&A session. We have four very, very distinguished scholars in this webinar today. Professor Stephen Hoffman, as I just said, sent a video which will be presented just now. Professor Stephen Hoffman is the director of the Global Strategy Lab. He's also professor at the York University and scientific director of the Institute of Population and Public Health in Canada. He's been the chair of the UN Research Roadmap for COVID-19, which, as Professor Luis Eugênio Melo has just mentioned, very much inspired this call. So he is a key person in setting the research agenda on COVID-19 worldwide. Professor Alice Norton as well, thanks a lot for joining us. She is the head of the COVID-19 Research Coordination and Learning Initiative, a joint initiative between the UK Collaborative on Development Research and the Global Research Collaborations for Infectious Disease Preparedness, the famous GLOBE-PDR. Professor Alice Norton is also professor at Oxford University and very much engaged on the research agenda on COVID-19. Professor André Brunoni, thanks a lot for joining us today. He is professor at the Medical School of the University of São Paulo and a very influential Brazilian scholar on issues related to mental health and COVID-19. And last but not least, Professor Ana Maria Almeida, professor at the Education School at the University of Campinas. She is also a member of the team of associate coordinators on social science at FAPESP and a researcher on education issues, particularly education and inequality. So a very, very distinguished team. I waste our time. Let's listen them, and we'll now watch the video sent by Professor Stephen Hoffman.
I'm delighted to present today about the UN Research Roadmap for the COVID-19 recovery. This effort was initiated by the UN Deputy Secretary General, Amina Mohammed, out of a desire to ensure that our recovery from COVID was not only one that got us back to the way things were, but back to a better normal, specifically around trying to achieve a more equitable, resilient, and sustainable future. And so one of the key things that's clear from this outbreak, and I hope you're able to see my slides, is that we know that this outbreak was not only a pandemic of a virus, it was of course that, but it was also a pandemic of social and economic inequalities. It was also a pandemic of massively important downstream consequences. And so when looking globally, one of the things that became very clear at the early parts of this outbreak was that, yes, that this was going to be an issue that required a massive medical and public health response like never before, but it also would be one that required a socio and economic response, perhaps like never before. And so some of the statistics that motivated some of the early thinking around the UN research roadmap for the COVID-19 recovery were statistics like these, such as in 2020, 71 million people were pushed into extreme poverty, essentially reversing quite significant gains that have made over the last couple of decades in terms of tackling global poverty. Another example, at 1.90% of students were out of schools during this pandemic. Some countries have reported that cases of domestic violence have increased by up to 30%. And 60% of countries have reported prison overcrowding, which of course is never good, but it's also particularly not good in the context of a pandemic where that would increase the risk of actually spreading COVID-19. And so in the UN's wisdom, early on in the outbreak, the United Nations came together and developed a socioeconomic recovery framework. This was a document that was very much intending to unite the UN system's efforts and help support countries to make sure that, of course, we need to tackle the virus and stop its spread, but also minimize the socioeconomic harms caused by that virus, as well as the responses to contain the virus, as well as get us on a track for better recovery. And so that UN socioeconomic response framework, it was published April 2020, and it highlighted 5 pillars where the United Nations and governments around the world and all stakeholders in society and citizens need to act together. The first is around health services and systems. The second around social protection and basic services. The third, economic response and recovery. The fourth, on macroeconomic response and multilateral collaboration. And fifth, on social cohesion and community resilience. Now, any socioeconomic recovery framework needs, of course, to be married with a plan to ensure that it benefits from the best available research evidence, so to make sure that it's going to have the biggest impact. We know that knowledge that's systematically derived through science is going to, as well as other knowledge systems, are going to allow us to make more informed decisions to guide our future. And so in her wisdom, the UN Deputy Secretary General invited the development of a UN research roadmap for the COVID-19 recovery that would be specifically complementing the UN socioeconomic recovery framework, the goal of which, in her words, was to catalyze a worldwide learning recovery effort, one where national and international strategies are informed by rigorous social scientific evidence generated in anticipation of, and of course during, the COVID-19 recovery period. And so with that, this effort was kicked off. I had the honor of leading that global effort along with colleagues around the world. It had 4 objectives, this rapid learning initiative. The first, of course, was ensuring that any efforts that are done to address the COVID-19 pandemic and its recovery would be informed by the best available research evidence. Second, to support the learning from earlier response efforts to inform later response efforts. That's key because, of course, we need to learn during a recovery effort. The goal would be to make sure those later efforts can benefit from research happening earlier on. Third, it was to bring renewed focus to the systemic issues that we've long known about as problems, but for which COVID-19 served as a grand revealer, and a need then to ensure that those issues, those challenges, as well as the marginalized populations who've been most affected by this crisis, are given the attention, resources, and engagement and power that's needed. Fourth, the UN Research Roadmap was intending to enable international scientific collaboration by creating a unifying global framework through which many researchers, research funding agencies, governments, and implementers all participated in its development. And of course, it's a pandemic and it's a crisis. So we got 10 weeks to do this. And so essentially, the thinking was this was commissioned in June 2020. And the thinking was that already at that moment, the world was steeped in responding to a pandemic. But of course, at some point, there would be the need to focus on recovery. And we needed to make sure that researchers and research funders were thinking about those research questions that would be needed for recovery well in advance, because of course, by the time the research and the knowledge is needed, it's too late to begin to start doing it at that point. So trying to give researchers, research funding agencies as much advance notice of what those priorities are. The thinking was we needed to rapidly do this in 10 weeks, making sure that, yes, it was as participatory and it was engaging people from around the world. It was quite an honor to have led this process, but also ensuring that it would be available at the time when it needs to be available, which we felt was the beginning of last fall. And so together to develop this roadmap, we convened 5 steering groups, co-chaired by different research leaders around the world. They involved 38 research funding agencies from 25 countries. We had 270 experts who weighed in different ways, whether through written submissions, virtual consultations, or key informant interviews. And we commissioned 5 scoping reviews, which have just recently been published and are now available in a peer-reviewed journal, as well as we collected written submissions. We did initial search results, looked at over 10,000 articles, and those scoping reviews included 320 primary studies. All of this coming together, working, identifying crosswalks between the issues, all focused on and responding to those 5 pillars that were articulated in the UN Socio-Economic Recovery Framework, published in April 2020 of that previous framework. And then this roadmap, delighted to, it was published in November of 2020, just a few months later. Ultimately, this research roadmap is, of course, it was born out of a crisis and out of a very difficult situation that we are all still living with and people around the world are still enduring. We decided, though, to take a hopeful look and identify that, yes, this is one of the most challenging, if not the most challenging, experiences that many of us have gone through in our lives, but it is also an opportunity. And so in that respect, we identify in this research roadmap that the socioeconomic recovery from COVID-19, it provides an opportunity not just for tweaks or small changes, it provides an opportunity for the kind of transformative changes that we need in order to achieve a better and brighter future, and ideally to get us and the world on track to achieving the Sustainable Development Goals by their 2030 deadline. And essentially what the research roadmap does is it presents a choice. It's a choice between we can go back to business as usual, or we can chart a course towards those transformative changes. The good news, or the good parts of business as usual, if we ended up there, is that we know how to do business as usual. And we did it before, and that's how we know we can go back to the way things were. And I guess the good news is we don't need research or innovation to do that. But I think everyone would agree that that would be rather a disappointing outcome. The world was not working for most people who live on this planet. We live in a very unequal world, one where so many of us are disappointed in the way that the world works for different people. And many people more directly face the consequences through their daily life. And so that doesn't seem like the best outcome from this shocking events that we're all currently experiencing. Instead, the UN Research Roadmap offers a different future, an equitable, resilient, and sustainable future, one that depends on transformative changes to get there. And indeed, the challenge with transformative changes is that we don't fully know exactly what's needed or how to get there. All the various implementation considerations, the social, economic, political, cultural context in which different interventions, policies, programs might work, might not work. And so as a result, in order to get to that better future, it's the harder path because it's not the way we knew how things worked. But it is the path that's going to get us to a better, brighter future. And to get there, we need research, and we need it with great haste. So with that, the research roadmap, it's structured, the report itself, which is publicly available. If you just search for UN Research Roadmap COVID-19, it'll come up in your early results. And it has identified as three different sections. The first is that it identifies the top 25 research priorities, 5 for each of the 5 socioeconomic recovery framework pillars. The second is it provides a framework for understanding both the opportunities and challenges that lie ahead with the COVID-19 recovery. Third, it identifies 5 science strategies to address the full research ecosystem and ideally ensure that science is there to encourage a better recovery post-COVID and the years after. So let me first talk about the research priorities, and I'll do this quickly because they are deeply described in great detail in the UN Research Roadmap document itself. But essentially, there are 25 research priorities, but if we had to summarize them as a single priority, all those 25 research priorities, they all seek to answer one overarching question, which is how can COVID-19 socioeconomic recovery efforts be purposefully designed to stimulate equity, resilience, and sustainability as paths towards progress towards the Sustainable Development Goals. Now, this is clear. It's essentially what we're talking about is a co-benefits framework. So we know that there's going to be unprecedented efforts to ensure an effective recovery out of this pandemic. And those efforts are going to be experienced and undertaken around the world in every country. What we need to make sure, and what this UN Research Roadmap attempts to do, is identify those research priorities which will help governments, civil society, industry, citizens, help everyone in order to not only build back, but actually recover better, recover more equitably, resiliently, and sustainably from this pandemic. And so in the document itself, we highlight those top 25 priorities, 5 priorities for each of the pillars. For example, within the health systems and services pillar, one of the questions is around how should health systems be designed so that they're responsive, adaptable, and accessible when they're needed. And within each of the 5 pillars, we also identify quick wins, one quick win, one game changer, and one best buy. So for example, under best buy within the health systems and services pillar, the question that gets prioritized is what strategies and financing models are most effective in expanding universal health coverage, noting, of course, that universal health coverage has been an essential social infrastructure to protect those citizens who have been lucky enough to benefit from it within different countries around the world that do have it. And noting that it represents not only a strategy for resilience, how do we make our societies more prepared for future pandemics like COVID-19, but also achieve outcomes for equity, resilience, and sustainability. Second example, this is in the pillar on social protection and basic services. And this one, again, highlights a range of issues. One, for example, is how can environments be built, shaped, and sustained in ways that allow all people to thrive? This highlights that, of course, we as individuals and so much of our health and well-being is determined not only by our genetic code, but also, for example, by our postal code, by the environments in which we live. And as a result, being able to purposefully shape those environments and ensure they're safe and thriving for all people becomes an essential research question that we need to think about. Of course, we know so much already. There's huge scientific work around exactly how do we build environments. It's also an area, though, where we need further research and is prioritized in this framework. Similarly, there's one quick win, one game changer, one best buy. Again, just highlight the best buy here. The question that was identified and prioritized was what are the most effective and equitable ways of ensuring basic income protection for all? The third one, and I'll go through these more quickly because they are described in detail in the UN Research Roadmap document itself. On economic response and recovery programs pillar, One of the questions was around how can economic recovery policies protect workers, ensure their well-being, and promote a resilient workforce? We've seen around the world during COVID-19 that workers in certain industries have faced the brunt of this pandemic and have not faced all the same measures of social protections that are needed to ensure a thriving economy, thriving well-being, and the health of everyone. Lots of research is needed to ensure. Of course, we also need to benefit from the research that we already know about in this area. And then in terms of an example, in terms of the game changer that we identified under this pillar, the question that was prioritized was how can innovative financial tools, such as gender budgeting and climate accounting, be leveraged to prevent negative downstream consequences of policies and maximize co-benefits for equity, resilience, and sustainability. Fourth, the pillar was focused on macroeconomic policies and multilateral collaboration. This highlighted 5 different priority research questions. And just to give one example, would be around how have recent global shocks affected the functioning and legitimacy of international institutions? We know that this is a time, of course, when we've seen some of the best global cooperation, as evidenced through, for example, the development of a COVID-19 vaccine in record time. But we've also, during this pandemic, seen some of the most hyper-polarized politics and some of the most challenging facets of international collaboration, whether it's around ensuring or not ensuring equitable access to the COVID vaccines that have been developed, or ensuring that our overall response efforts are working for all countries and all citizens around the world. And then finally, in terms of the 5th pillar, it was focused on social cohesion and community resilience. And one example of a question here was around how can communities be optimally engaged in decision-making during emergencies to strengthen social cohesion. One of the challenges that have been faced in societies all around the world is how to give citizens voice at a time when some of the mechanisms that we've long depended on, whether it's town halls or consultations, have not been possible, or not possible in the way they used to be possible because of the pandemic and its constraining circumstances. How do we ensure that communities are engaged in that decision-making during emergencies now and in the future? And then in terms of, for example, a quick win that was identified under this pillar, it's around how does misinformation spread and how can digital technologies be used to minimize it? That was just a brief high-level overview of some parts of the top 25 research priorities identified through this global participatory process. But this framework doesn't end there. So in addition to identifying the 25 research priorities, as well as further elaborations of them in the document, we also try to provide a bit of a framework about how do we think overall about a recovery. And I mentioned earlier that the 25 research priorities were all intended to answer a single overarching question. And indeed, that question provides a framework to think about it. It basically is calling on us, it's calling on researchers, research funding agencies, partners, and citizens to think about a quadruple bottom line from COVID-19 recovery efforts. So yes, as we are working and as governments and others around the world are working to ensure a good recovery from COVID-19, ensuring that those solutions achieve the direct benefits that they're trying to achieve, how much better would it be if we could simultaneously also advance equity? How much even better would it be if, in addition to those initial goal that's being tried to be achieved, and in addition to equity, we also ensure that those efforts make our systems more resilient to future threats of various kinds? And then third, how much even better would it be if we could achieve the direct benefits as well as equity benefits, resilience benefits, and sustainability benefits? That would be achieving a quadruple bottom line. But this is not easy. And indeed, we need research. We need the full range of ways of knowing in order to figure out how is it that we can achieve this quadruple bottom line and achieve not just a recovery, but a better recovery. And indeed, the way that we frame it in the UN Research Roadmap is that we could have a recovery, and we will have a recovery, and we hope that it's an equitable recovery, and I really hope as well that it's a sustainable recovery. But the UN Research Roadmap also says that we need a resilient recovery too. We need all three, because like a tripod, without one, the whole recovery can collapse. In the case of resilience, it collapses the next time we have a threat like COVID-19 or another natural disaster. And if the systems aren't built to withstand it, we're going to be back to where we were, which none of us wants to be at. Finally, the UN Research Roadmap highlights that if we want to make sure that not only our policies and practices are informed by the best available research evidence, we need to make sure that science itself, that scientific systems are able to benefit as well from systematic efforts for its improvement. And for that, the Research Roadmap highlights 5 science strategies that are needed in all societies to ensure better recovery. The first is around data infrastructure. The second is around building up the science of implementation. So implementation study science, which is the study of methods and strategies to promote the uptake of effective interventions into practices, programs, and policies. The third is about how we build rapid learning systems. The fourth around knowledge mobilization. And the fifth is around developing and building a science of science, ensuring that the way that we fund research, the way that research practices are evaluated, the way we support effective and good research cultures and systems, ensuring that can be efficient, open, inclusive, and impactful. In terms of next steps, I mentioned this document was published November 2020. What's clear is that we need researchers to help tackle these complex research priorities and inform those kind of transformative solutions that are needed to get us to a better recovery. We need research funding agencies to make investments, ensuring that these priorities can be tackled by the best minds around the world. And of course, we need governments, we need civil society organizations, we need community leaders, we need public health professionals who are going to ask for this research, who are going to contribute to it, who are going to help lead it, who are going to support it, and ideally who actually institutionalize its use in the various decision-making processes, which are ultimately going to decide whether we do go back to business as usual, or if we can achieve that better, more equitable, resilient, and sustainable future through transformative changes. I will just flag that this UN Research Roadmap has gotten quite a lot of traction. One event that happened January 29th, 2021 was a convening of over 40 research funding agencies from around the world, as well as representatives from 60 UN missions in New York, 5 UN agencies, as well as many researchers around the world joining. This was a convening with the UN Deputy Secretary General, focused on how do we leverage the power of science for a better recovery. And this event, it was a really helpful moment that brought people together and was able to articulate that actually these research priorities, they were identified in a short period of time, at a time when that rapidity was needed, but that the 25 research priorities have enduring value in terms of the fact that not only are those priorities ones that are shared around the world, they're very relevant, no matter what country one is situating themselves in, of course, with important adaptations for each unique context, but they're also important with a pandemic and irrespective of a pandemic as well. And so that was one effort to gain some momentum. And indeed, since then, there have been lots of efforts to disseminate the roadmap, both through UN agencies as well as through the International Science Council. There's some early efforts to develop partnerships between regional and country UN teams, as well as national research funding agencies through different events. There's exploring of new mechanisms for coordination between UN agencies and international research funding agencies, which is very important. And one thing I'm very excited about is that we're actually tracking progress on this roadmap's implementation. And thanks to Glopidar and UK CRD, there will, for example, be a funding tracker that will be able to see how much research, at least from a money perspective, will be going into these different research questions. With that, let me just end by thanking all of you and thanking all of the partners and the team members who made this UN Research Roadmap for the COVID-19 recovery possible. This really was an unprecedented collaboration of so many different research funding agencies, research leaders, UN agencies, governments, that it really was an honor to lead this process. In Canada, that included the Social Sciences and Humanities Research Council, the Natural Sciences and Engineering Research Council, IDRC. It included Health Canada, Public Health Agency of Canada, Grand Challenges Canada. And then outside of Canada, this was an effort that engaged countries on every continent. In Brazil, that was FAPESP, in Fiocruz, in South Africa, that included the Medical Research Council and the Social Sciences Research Council. In Sri Lanka, it was the National Science Foundation. And to have that opportunity to work globally at a time when physical distancing requires us to actually be physically apart was quite an honor. I think hopefully something that was also resulting in something that can be important. So with that, let me thank all of you. And I look forward to the time when we can be together physically and enjoy each other's company. Thank you.
So as you may have noticed, the UN aims at mobilize by means of this research roadmap the social science community to engage in collaborative research, of course, because the UN aims at mobilizing a number of funding agencies. But as Professor Stephen just explained it, the spirit, the purpose of this research roadmap is to mobilize the social science community to engage in policy-oriented research around certain priorities oriented to provide evidence, solid evidence to inform policy decisions. So you'll find at the FAPESP website in the call of this in the document of this call a link to this document where you'll find detailed explanations about the content of these research priorities. So our next speaker is Professor Edison Norton. Thanks again for joining us today, Professor Norton, and the screen is yours.
Thank you very much for having me indeed. I'll just make sure this is full screen for you now. Excellent. Thank you very much for inviting me to join you today. I join you from the UK, where I lead the COVID Circle initiative. The COVID Circle initiative was set up a year ago in response to the COVID-19 pandemic. It's a joint initiative between two funders groups, one called the UK Collaborative on Development Research, which brings together UK funders, including the Wellcome Trust and government funders who fund research for development across the world. And also, importantly, the Glopidar funders group, which is a global funders group focused on coordinating and collaborating for research in epidemics and pandemics. And this brings together over 30 global research funders, including FAPESP. So today I've been invited to talk to you about the work we've been doing with this initiative, which broadly has been to attempt to support greater research coordination and learning during the COVID-19 pandemic. And then I'll touch on how that is now pivoting to relate to the UN research roadmap that Stephen Hoffman has just presented, and is obviously of key relevance to the call that FAPESP have just launched. So there's 4 elements to the COVID Circle initiative that I lead across these different organizations. To start with, which I won't focus much time on today, we aligned global research funders to a set of principles for supporting the best global research in the pandemic under principles such as equity of research partnerships, alignment to both global research priorities and local research priorities, and open data sharing and other aspects to really share this best practice amongst the funders to improve the research response. The second element, which I will focus on a lot today, has been around mapping and analysis. The idea being that a collaborative global response is only possible if it's visible what other researchers are doing and what other research funders are doing. And this has been a core part of what we've been doing. We also have done some work to support research coordination, and I will share with you a website that we've developed on that, which may contain some useful resources for your work. And then finally, we're doing a lot of work around learning from the research response to COVID. Again, I'll focus less time on that today, but it's really around looking at how the global research response can be improved both during this pandemic and for future epidemics and pandemics. So one of the focuses of what I really want to talk to you, and I've been asked to talk to you about today, is our COVID-19 project tracker. This was set up following a meeting that the WHO convened in January 2020, where they brought together several hundred researchers from across the globe to try and define a set of research priorities for COVID. This was then adopted by both the Glopidar group of funders and the World Health Organization as a research priority list of the really urgent priorities that needed to be met in that initial year of the COVID research response. What was felt then was that there was a need to visibly look at what research was being funded and undertaken, such that both funders and, importantly, researchers could explore that, could look at the gaps, and could look at who to collaborate with to improve the global coherence of the research response. So we set up this tracker. The website linked to it is at the bottom, and on it we now have over 10,000 research projects from around the world. And I'll describe, but importantly, these are coded based on the abstracts to the types of research that they're addressing to make it more accessible for both researchers and funders to use it. So in terms of what's visible on the tracker website, if you explore it, we have these Tableau dashboards, which, as I say, are initially aligned to the WHO research priority list. I'll come on to how we're looking at other research priorities soon. And essentially you can navigate this by looking at those different priority areas, looking at the numbers of projects funded. And when you click on these projects, you then gain access to the abstracts of those projects, to the researchers undertaking the projects and the funders who are funding them. And all this detail is within this. And what, as you can see, this allows us to produce is a dashboard for the research priorities, whereby it is obvious those areas where there are a lot of research projects being undertaken, and where researchers globally might want to investigate who are undertaking similar research projects to learn and build on each other's work. And also, importantly, can identify where there's gaps, where some research areas that have been prioritized are not yet being funded and undertaken. And clearly that's of great interest, both to researchers and to research funders. The other way in which the data can be easily explored on the website is through a global map. So as far as we can, all of the research is tagged by the location in which the research is being undertaken. So you can use the map to click on a country and to then explore all the research that's being undertaken in that country, and again see the underlying details about the abstract of what that research is about, who's undertaking it, who they're funded by, and the duration and such like. So I encourage you to explore this live resource, especially as you're looking at developing proposals for this call, and see which collaborators are out there and what research is already being undertaken globally, and where the particular gaps might also be. So as you will see on that dashboard, the research is aligned to the WHO priorities. However, there's a lot more depth in there, and we've been doing a lot of work with some other research priority areas a notable one, obviously being the UN research roadmap for the COVID-19 recovery. So what we now have a joint collaboration with Stephen Hoffman on is to explicitly code the data in this tracker against this new UN research roadmap. And the results for that should be available soon on the tracker and live for the data to be extracted as well. Although that data is already in there, and I'll come on to more of that in a moment. The other element we've been doing is a lot of work with colleagues in Africa to try and help look at research, local, regional research priorities there. And again, use the tracker as a way of working out where the gaps and the areas for improved collaboration may be. So beyond that live tracker tool, which you can interface with, you can also download the entire data set for free to interrogate in any way that is of use to you. And that is literally a download of an Excel file or a Google spreadsheet that can enable you to do that, free to use and as live as we have it on the data, because we really want you as funders and as researchers to interact with that. Given everyone is very busy, we also are undertaking a number of analyses ourselves that go beyond what's available on that live database. So the main one to draw your attention to is a live living mapping review, which we publish on a website called Welcome Open Research, which gives a quarterly update on the funding trends and on the gaps and synergies around the research. We also produce specific policy briefs on this, and again have done some regional funding analyses before. So this gives an extra level of analysis detail beyond what's available on that live tracker site. So to update you, what sort of things are we finding from these reviews is, I'll come on to how the numbers of research projects are increasing, but we now have over 100 funders represented on this tracker in terms of the research funding that they're undertaking. What we're finding is that the majority of this research is being undertaken, at least in part, in high-income countries. And clearly we're trying to map and trying to essentially do some advocacy to highlight the needs for research and context-specific research in lower middle-income countries as a result of seeing this trend. And the funding investment globally that we've managed to capture to date is over 3.8 billion. I think the slide's slightly out of date. I think we've just gone over 4 billion. So what's clear is that there has been a huge funding response to this pandemic. But what's also clear is that this has been disparate, repetitive in some cases, and that there is a real need for a call for repeated collaboration and coherence on this. Again, this maps here where that research funding is being undertaken, and again highlights the predominance of research being undertaken in high-income countries, although there is certainly an increased trend of research being undertaken in the lower middle-income countries, which is great to start seeing, and this call obviously will add to that. As I say, we've been looking at how you can look at the amounts of money and the projects aligned to the WHO categories. We will also be doing this prospectively for the UN roadmap categories. And you can then start to explicitly see those areas which probably do need a lot more research investment, such as that of animal and environmental research. So what also we're very keen at looking at is how the global funding trend is changing over time. There was an awful lot of release of research funding money early in the pandemic, as one might expect, and we're now really seeing a trend for plateauing, and also looking more forward-looking research calls, such as, you know, in part the one that's being launched today, looking towards the recovery, looking longer term, which is of interest. But again, this plateauing of funding to us says that there is a need now greater than ever for real global coordination and really ensuring that the limited funds that are still being released are diverted to where there is the most need. Now, what I've shown you in terms of coding has all been reasonably biomedical and aligned to the WHO roadmap. What's worth noting, and what the slide shows, is that there's an awful lot of research in the tracker that goes beyond that and goes more into the remit of the UN Research Roadmap. And what we've been doing is we've been starting to categorize that within the tracker. So it is there, you can see it, you can find it and explore it. And as I say, what we're doing now is the next step of more specifically aligning that to the UN Research Roadmap. And we will certainly update you as soon as that's done in the next couple of months. So as I say, COVID Circle is covering many elements of it, attempting to improve the coherence of the research response for COVID-19. I've focused a lot in terms of explaining to you what the tracker is, how that can be used and how that is being used by funders and researchers. I also want to highlight in terms of research coordination that we have this resource with the website here at the bottom, which has a range of useful resources for researchers, which you may also wish to explore, and is another good link in to this tracker data. So thank you very much for your time and attention, and I hope that you find that useful. And although I cannot stay for questions due to a clash of commitments, I'm very happy to be contacted by email after this if any of you are interested in this work. Thank you.
Many thanks, Professor Norton, for this presenting, for your participation, first of all, but second, for providing us such a detailed information on such an important tool for researchers at São Paulo and worldwide to find opportunities for collaboration and coordinate themselves around priority research subjects. So thanks a lot again for joining us today, and for sure we'll be in contact, we'll be in touch regarding these research opportunities. Our next speaker is Professor André Brunoni, but before Professor André Brunoni and Professor Anna make their presentations, I would like to just stress you that this call, maybe to clarify you that this call is very much inspired in the UN research roadmap, but we identified the FAPESP team who was engaged in elaborating this call, that there were two key themes that were not so stressed, so let's say detailed in the UN roadmap, that we think are very important, both for the social science research agenda and for the Paulista FAPESP research scholars. So in these two themes are mental health and education. That's why we also included these two areas, research areas, in the call, and that's why Professor André Brunoni and Professor Ana Almeida are joining us today. So their speech aim at calling our attention to these two important areas research agenda. So Professor André Brunoni, thanks a lot for joining us, and the screen is yours.
So thank you. Let me just open my presentation here. Okay, so first, good morning to everyone, or afternoon, or good night. First, I would like to thank Professor Eugenio Melo, Professor Maria, and Professor Marta, and FAPESP for inviting me to talk about this topic that I have been intensively researching during 2020. And I'm going to discuss a little bit more about the mental health during the pandemic, findings that we had worldwide from 2020, and implications for future research. Obviously, all of you know about the COVID pandemic that started in late 19 in China and rapidly spread throughout the world in 2020. And all the restrictive measures that we had last year and until today, not only the quintessential symbolism of that, which is the use of masks, but also many other restrictions and quarantine and other measures that were being used and are being used to contain the dissemination of the virus. And because of all these restrictions and disruption of daily routine and daily activities, there was an expectation that would be that an increase, a surge of mental disorders would happen, increased mental symptoms would happen. And therefore, psychiatrists were at the very beginning of the pandemic in the first semester of 2020 were alerting us about a possible tsunami of mental illness after lockdown, or the next global pandemic that would be the mental disorders increase during and after the pandemic. And even this image became famous, at least in the psychiatry circle. So actually this is a Twitter, but it became quite famous, this idea of a theoretical fourth wave that would happen after the initial pandemic clinical waves. Then we would have an extra mental wave of mental symptoms. And this was expected based not only on the clinician or in the psychiatrist's feelings, so to speak, but also based on prior evidence in prior pandemics, because we know that social isolation, fear, and loneliness are psychological factors that have a great impact on mental health, and this would happen during the pandemic. Also, we know that there is an increase in mental symptoms and mental disorder after economic recession. That also happened in 2020. We were also afraid of our patients who have pre-existing mental disorders or substance use disorders, that they would aggravate their symptoms, possibly with an increase in suicidal attempts as well. And also there was the concern that people would experience more symptoms such as worry, insomnia, anxiety, and these symptoms would eventually catalyze into full-blown mental disorders. At the very beginning, during the first semester of 2020, there were many articles and many studies with cross-sectional design that were investigating whether there were higher or high symptoms of anxiety, depression, and stress. This is a review basically from the first semester of 2020, and they were showing that there were high rates of anxiety, depression, PTSD, and psychological distress and stress. However, the rates, as you can see here, were very varied. They were also able to find some risk factors associated with these factors, such as being a woman, being relatively younger, and have chronic and psychiatric illness. However, we have to note that these studies had a very particular design that they might not be suitable to generalize their conclusions. So basically they were of cross-sectional design. They used convenience, snowball samples. They only collect data during the pandemic, and they were mainly focused on mental symptoms. What they mean by mental symptoms, they were collecting data on anxiety, depression, but as symptoms and not as disorders. And to really have a real evidence of whether or not this symptom or this disorders increase, we would need a different type of design. So using questionnaires addressing psychiatric disorders, designs of longitudinal design, and then the cohort designs, we would need ideally representative samples, and we would need data before the pandemic, not only data in the heat of the moment, but also how were these people, how were these patients before the pandemic happened, because quite surprisingly, they might not be good also before the pandemic. And also there was no available data in special regions such as Latin America and low and middle income countries where most of the population lives and where we have extra issues regarding socioeconomic vulnerability, for instance. And because of considering all these issues, we decided to address these issues in the ELSA Brazil study. So ELSA Brazil is the longest Brazilian longitudinal cohort. It has about 15,000 participants from 6 institutions. And in our study, that was rapidly sponsored by FAPESP, by the way, we established a mental health cohort in the city of São Paulo. So we moved quite fast. In March 15, lockdown started in São Paulo. I think most of you remember it was a Monday, and then the University of São Paulo was closed. Many places were closed, and then we already started to plan this study. Between March and April, we did many meetings and we started to design our study. And in May 18, so almost 2 months after the lockdown, we started collecting data. And our initial aim was to assess the rates of psychiatric disorders and symptoms before and during the pandemic. So first to clarify this question and also to assess risk factors such as clinical and demographic variables, as well as leisure activities and quarantine behaviors during the pandemic, whether or not they would be associated with clinical outcomes. We have just published this paper 3 weeks ago. And basically, this is the flow chart of the study. So just to remember you, we have in ELSA the first wave that happened in 2008-10, the second wave in 12-14, the third wave in 17-19, and then we had the COVID waves during the pandemic. So we did 3 assessments in 2020. We are doing a 4th one right now, but in 2020 we did in July, September, and September, December, and we had around 2,000 participants. We only did in São Paulo Center. So for our first aim, we actually found that there was not an increase, not a surge in mental disorders. So observing data from 2008 onwards, at least in 3 assessments, we found that the rate of common disorders was stable and varying between 20-25%. We have to remember that these rates are high. So 25% of people in ELSA had a common mental disorder. Using the same instrument, data from other cohorts in the UK, for instance, are around 15 to 18%. So these numbers were already high, but they did not increase. We saw an instability in depressive disorders and OCD symptoms in OCD disorder. And quite surprisingly, the rate of anxiety disorders is slightly decreased. We believe that this particularly is a particular characteristic of the instrument that asks that the symptoms of anxiety have to be present for at least 6 months. And because we did this assessment in July, maybe people, when looking back in the past, they would say, for some sort of anchor bias, for instance, that the symptoms of anxiety just started after the pandemic and they were not present before. Maybe that was something that got a little bit confused. And when we did a new analysis, only considering symptoms of anxiety presenting for at least 2 weeks, then we saw an instability in anxiety disorders as well. So this was a view from before to during the pandemic, and now the variation of mental symptoms over time, so over 2020. And interestingly, we saw here on the left is before the pandemic, on the right is during the pandemic, and we saw that at the beginning there was a little bit a small increase in symptoms, and they decreased over time, ultimately reaching slightly lower levels than than in the beginning. So just to remember again, this is data from 2020. We didn't capture all the things that happened in Brazil in 2021 yet in this graph. And about risk factors, we found that younger people, people of non-white ethnicity, people with no college degree, and women were at increased risk of developing mental disorders. These are common social demographic variables associated with mental disorders, only not defined that younger people had more mental disorders. In literature, it's usually the older people, but maybe here they were more protected and less vulnerable to economic downturns, for instance. We found that having good or improved relationship quality protected the development of mental disorders. We found that having good physical health also protected developing mental disorders. In general, having mental and physical factors such as use of alcohol, smoking, having chronic disorders, and obesity, there was generally at least a trend of developing more mental disorder. Also, having COVID symptoms were associated with increased risk, and concerns about income and distress were also associated with increased risk of mental disorders. What happened worldwide? So in a meta-analysis that was done in 70,000 participants in 20 studies, we can see here a huge heterogeneity. So I-squared of 99% for, you know, in meta-analysis that this is extremely high heterogeneity, and basically we can see this. So some studies showing an increase, others showing nothing, and others showing a decrease. There is too much variability, but at the end there was a very small increase, effect size of 0.17, which is very well, clinically negligible, if you can say that. And so it was not really a huge increase or a huge effect of lockdown on mental symptoms. There is this recent study showing that there was not an increase in suicides around the globe, and actually in many regions around the globe, actually there was a slight decrease in the numbers of suicides. Of course, we know that this type of comparison year on year is not quite the proper analysis we have when we considering temporal trends. But I think the important finding here is that there was not a huge increase as some would have expected as well in 2020. And how can we explain this finding? So maybe one hypothesis is that isolation was mitigated, or the psychological impact of isolation was mitigated by connectivity, such as using social media or even doing home office. That idea presented by Durkheim of collective effervescence, meaning that we are all in the same boat, we are suffering together, we are together facing the pandemic. Maybe in 2020 there is an initial resilience period that will vanish over time, and maybe the news, these are not necessarily good news. Maybe this is a ceiling effect. So people were already unhappy and we didn't know about it. And our first speaker was also commenting about that. So do we want to return to the status quo? The status quo was already not good, was already bad for people with mental disorders. Maybe that's just reflecting that here. But anyway, so this shows that we have complex phenomena, and also that we are mainly examining average values. So maybe we need to better analyze the data to understand a little better what's happening. And thinking about new ways of analyzing this data, there is this interesting theory about the network analysis of mental disorders that says that not only having the symptoms per se is important, but also how they connect, how the mental disorders connect. And this theory also proposed that if there is an environmental, an external factor pressing this network, it will help the network to solidify and then to form a mental disorder. So basically, we would have two outcomes when there is an external factor. Either the network would be resilient, and after the stressor goes away, we don't have symptoms anymore, or if the network is vulnerable, then after the stressor goes out, then the network does not vanish, it stays there. And of course, we can, it's a very tentative argument saying that the pandemic is an external factor. So let's see what happened. We did this analysis. Paulo, one of her students, is doing that. Basically, we can see overall stability of mental symptoms per se. But when we analyze the structure of the network, we can see here at baseline, then in 2016 and 18, and now during the pandemic, we can see that there are changes in the network. We can see that the network is more connected. We can see particularly around anxiety and worry, but also overall, we can see that the network is more connected. So making sense of this idea that the pandemic is precipitating a greater connectivity of mental symptoms, and maybe after the pandemic goes away, these symptoms will remain connected, and maybe also increasing the risk of developing mental disorders in the future. Another approach that we are using is trying to differentiate different trajectories between our groups, so we can see our cohort. So we can see here that we said that overall there was no changes, but we can see here that at least 10% of our sample already have mental symptoms, and the risk factors predicting not having versus having severe mental symptoms are different. So maybe that's one pathway, one thing that we should pursue in the upcoming research. As it was presented at the beginning, we not, of course, discuss that, but thinking about the big pictures, so how we can tackle the issue of COVID-19, Sustainable Development Goals, and particularly on mental health, and also taking a good look of the roadmap for COVID-19 recovery that was shown here. There are many approaches that we can use specifically to mental health, and I found something very interesting here. So how can we develop social protections and basic services to promote population mental health? It's interesting here that there would be interesting to have a focus on people who are at increased risk, such as frontline workers, but also those with more vulnerable socioeconomic conditions, and also gender-based analysis, because the pandemic impacts differently men and women. Here there are many proposals that can be approached. So it's interesting to look at this document in details, but possibly research pathways that we can suggest to be accomplished in the future would be in 2021 and onwards. First, to have an active surveillance of mental symptoms during and in the post-pandemic world. Also identifying and developing identification and development of resilience factors in these populations. So for instance, if being connected is a resilience factor, how can we develop more connectivity in people who are vulnerable to develop mental disorders? Also develop psychosocial interventions that enhance addition to procedures to minimize COVID-19 dissemination. I did not discuss that, but we know that in certain countries, I think it was in the newspaper today or yesterday, that in the USA, for instance, they are having the different problem of having enough vaccines, but not people who wants to be vaccinated. So how we can tackle these people from a psychological point of view, and how can we develop interventions that would enhance addition to receiving vaccines or to use masks, for instance. And finally, thinking specifically about patients with mental disorders, what would be their risk and resilience factors. So 20 minutes straight. So thank you for your attention.
Many thanks, Professor André Brunoni. I would just like to remind the audience that Professor André Brunoni will stay with us for the Q&A section. And so you can send questions to either him or Professor Ana Maria, who will be the next to make her presentation, to the live at FAPESP BR, the FAPESP team. The questions can be either in English or Portuguese, and the FAPESP team will collect and organize them. And so Professor André Brunoni and Professor Ana Maria Almeida will be able to answer your questions afterwards. So I'll just pass the screen to Professor Ana Maria Almeida, thanking her again for joining us today.
Oh, hi. Hello, everyone. Good morning or good afternoon, whatever you are. It's really a privilege to be here in this morning or this afternoon, it depends, but to connect with you in the middle of such loss and sadness, in the middle of such a crisis, to have this chance to think for a few hours about the future, or more specifically, to consider the ways in which human agency can be mobilized to support a recovery from this pandemic in a way that does not put us back in the same position that allowed for this to happen in the first place, I think, but also that take this as an opportunity for learning and growth. Learning and growth as individuals, learning and growth as society, learning and growth as government, and so on. So in this conversation, we are stressing the role that research can play in helping us navigate this challenge. And we are taking as a fact that new knowledge represents our best chance for recovery, for being better afterwards than what we were in the beginning, before the COVID-19 crisis. So research, new knowledge can play this role because societies must act fast, but they have limited time to do that, and they have limited resources. So in situations like this, the push towards going back to business as normal, as usual, as our first guest said, mentioned and highlighted very well, this push can be irresistible. In this case, due to the lack of time and resources, business as usual will mean going back 10 years or more. And we think this is not acceptable. I will share now my screen with you just to guide us, use this presentation to guide our conversation. Just a second. So we are talking here about a research agenda for COVID-19 recovery, and the theme is education. So what we are trying to advance is the idea that instead of going down the road of business as usual, we must engage in a collective endeavor to produce knowledge that can pave the way for transformative change. So this is the idea I'd like to put forward today, and while talking about education. So as we know, education has been one of the hardest hit areas in this pandemic. The closure of schools affected 90% of school-age children around the globe, interrupting conventional learning, putting children at risk, and creating a significant strain on parents, especially mothers, to say the least. Preventing families from sometimes from engaging in their usual line of work, of course, having an impact on revenue, and as our colleague said before, in mental health as well. So, but as we know, the closure of schools did not impact all children equally. Why? Because inequalities were already an important factor in schools' outcome, and they have made the losses incredibly asymmetrical. The COVID-19 crisis has not invented educational inequalities. As we know, it has exposed them. It has made them visible. It has exposed the fragilities and the unsustainable practices that predate this pandemic. You see the gradient of these inequalities in this slide that shows the results obtained by 15-year-old children in the PISA reading exam in 2009. So I chose purposefully this slide or this period. We are talking here about a period where growth was the economic landscape was not already touched by the 2008 crisis. And what we have here is something very, very startling. First, of course, there is something that calls our attention immediately is the difference, the difference in achievement between countries. So we have here in this horizontal axis, a group of countries, a long list of countries, very different countries, different in the size of their population, in the size of the GDP, they are different also in terms of political systems. They are different in terms of their more or less engagement with innovation or with democracy and so on. So, and in this vertical axis, we have the results, the grades or the points that the students could achieve in this exam that was that had the goal of measuring their ability or their performance, their competence in reading. So we have, of course, as we see, a very, very strong inequality among countries. But we have a second order of inequality that's very striking as well. It's the difference of achievement inside the countries. So we have in this long list of countries, one permanent, one regularity, that it is the fact that the performance in this exam is always correlated with the socioeconomic background, the socioeconomic origin of the student. You see that in this diverse list of countries, in this diverse list of experiences of schooling that these countries provide to their students, we have this very, very regular, very, very strong association between reading performance and the social and the economic background of the students. So this is not something that happened during the pandemic. This is something that has been with us for a long time now. And so the results of the 2009 PISA exam is not an anomaly. It's not something that happened for like some sort of a crisis or something that made this year particular or different. On the opposite, they are routine. This kind of result is routine. They are very known in the educational systems, and the association between socioeconomic origin and school results has been known for more than a century now. Since the middle of the 20th century, when it was established that school results are not a result of the of each individual natural abilities, researchers have dedicated themselves to show the complex social dynamics that produce the results shown in this table. A great body of work has been built in this area, but despite of that, research findings have not been informing policy and supporting change in the extent we would expect or we would like to see. Explanations exist, but they have not been sufficient to support change. Why is that? Are we doomed? Or is it possible to overcome this impediment? So the exposition of educational inequalities caused by the pandemic has been painful. It has also forced societies to face a reality that has been, for the most part of the time, hidden or naturalized. The outcry has been immense. The public discourse has been reacting to this disclosure, to this exposition. And it might indicate that our belief systems and our political systems are now, or are becoming now, more reasonably ripe to accept the need to move in a different direction. It might indicate that we have a historic opportunity for change. And that's why the investment in building robust evidence to support policy is urgent. Governments will have to act fast, and they have limited resources. Research can be then instrumental to identify the dynamics that lead to educational inequalities in each school system, in each school, in each classroom. It can also be instrumental to identify solutions, to adapt and scale them up to meet specific needs. It can also advance knowledge on implementation. What can be made to make knowledge available to policymakers? What can be made to support policymakers interested in using knowledge to guide their decisions? So let's start by considering what we know. So during the pandemic, some research or some evaluations were done, and they discovered that many countries have closed, that have had school closures. We'll have this data in a while. And they used a variety of remote learning resources, radio and television education, online instructional resources, instructional packages. Some countries have used a composition or a combination of these strategies. It was not easy. The majority of the countries have closed their schools for many weeks, some for many months, as in the case of Brazil. And this has been like a very widespread situation, a situation that as it is that widespread, invites us or gives us the possibility of interacting with each other to build knowledge that can be meaningful for the localized situations of each countries, of states, of cities, and so on. So the fact that we were all in this together might help us to build chains of solidarity, even in regards to building research together and building knowledge together that can help us to overcome this situation without necessarily going back to the same structures, the same practices we had before. So one area that was very sensitive or that became very clear, very obvious for everyone was the difficulties that the systems had, the educational systems had, to provide the students with rapidly, in the context of crisis, with the resources they needed in order to continue to learn, to continue with the learning processes they were involved with. So in this, because of that, the teacher situation, the unpreparedness of the teachers was something that put a lot of pressure on the shoulders of them, and made the relationship of the families with the schools and of course the governments that were in charge of the schools very tense and very complicated. And this is one area that we should, of course, work on and pay attention to in order to build a better future, or a better recovery for everyone. So we have then globally some things that are common. We have schools closure everywhere. We had governments inventing ways of going on with the learning processes. We have teachers who felt they were not prepared, and families who were asking from the teachers and from the schools for solutions that sometimes, or most of the time, neither the teachers or the schools were able to provide. In Brazil was not different. Brazil has had from the middle of from the 80s until now, has had real advances in increasing the access to school. Also, Brazil has been quite successful in providing real advances in learning. It is not enough, but we have had real advances. This is not really something that is always is very frequently on the pages of the newspapers, because, of course, since we started in a position that was that lacked. We had a lot of students out of school without access to schoolrooms, to teachers, to learning opportunities, and these students had to be incorporated, and in a context, of course, in which the country had to build expertise and also had to provide resources for that. We started from a very low position, and we progressed. We have progressed, but this progress is not always acknowledged as such, and we have this discourse that stresses and highlights the lack, what is lacking, what we have to do, and what we are supposed to do. And this, I will like to argue here, is that provides us with maybe an opportunity to reinvent the process, to reinvent the process of learning, to reinvent schools, and to use all the creativity of the research that Brazil has developed in this area and is developing in order to provide new solutions and new ways of dealing with our very traditional problems. So, more specifically, we will have to deal with, continue to deal with the problem of the exclusion from school. Around 1 million school-age children was not attending school in November 2020 because of the pandemic. Children are not, some because of the pandemic, some were already excluded because they had no access to preschool and had no access to secondary school or middle school, as we call it here. But children are not excluded equally from school. It depends, as I said before, on socioeconomic background and race. Also, we have to deal with the issue of learning. General low level of learning, lower level of learning than we would expect or desire, and inequalities in learning. And we have developed, the country and the globe has developed a very concrete and consistent and substantive body of research, of knowledge that can help to answer to the questions that we need to ask, we need to answer in order to face and work to overcome this situation that the pandemic exposed and the pandemic made worse. So the research can help us to go faster and deeper. That's the bet. That's the wish we all have. So when more than 1 million children are already out of school, we notice that the severance of ties between students and schools is not inherent to crisis and emergencies. When a large proportion of students does not learn what's expected, we notice that the losses in learning are an everyday reality, even when there is no major crisis. When learning is so strongly correlated with race and socioeconomic background, we realize that inequality of opportunities were not born during this pandemic. So let's talk a little bit about these 3 areas, and then I'm coming to finish my talk here. So first, I'd like to stress this theme of the social characteristics of the students and their effects on the learning outcomes. So this is a classic issue in educational research and a bit vexing. It's a bit vexing because, embarrassing as well, because since the field has been dealing with it for a long time, it reached a point around the 1990s, if I'm not mistaken, when some of our researchers more connected with policy gave up considering the integration of the social characteristics of the students in their analysis of the causations or the factors that promote or that prevent students from learning. The general idea was, okay, we have this huge inequality in our country. This is big, it's not easy. We cannot use the educational policy directly to deal with it. We have to concentrate educational policy in advancing some areas of the school so that the schools can do something. But we need research now to advance this thought, to challenge this idea in order to build schools that are good for all students, that are effective to all students. And how do we do that? What kind of gaps in knowledge we have that prevent us to do that? And as we will say, I will say by more at the end, it's not only a matter of knowledge, right? It's also a matter of how to influence policy, how this knowledge can be really useful and used by those who make the decisions, who organize the system, and so on. So along with the social characteristics of the students, we have questions about pedagogy. What educational systems can do to answer more efficiently to the diverse body of students? What innovative ideas about this have been concocted since the beginning of the 20th century? A lot of them. But how can educational systems use really effectively these ideas in order to make change happen, in order to diversify, for example, their approach to knowledge while maintaining a common basis that allow for building community, diversify their approach in order to have the students, the diversity of the students connect better with the schools. How can we do that? How to do that in the face of the relative lack of resources is something also that if we are talking about implementation, if we are talking about change, we have to take into account. So regarding teacher training, do we know what training is needed? Do we know the impact of pre-service and in-service training? What do teachers do with the training they receive? Are we aware of that? Have we reached a situation where we can really understand that? Can we understand how teachers change their practices and what moves them to change when they change? What makes them to engage in transformative teaching practices? What to do when new abilities are urgently needed, as it was the case now with the pandemic? Those are questions that must attract our attention, must move us to contribute to this new era, to this new phase, to the new moment in which we are, and to take this as an opportunity to work together. So questions about teacher hiring and career are as important as the previous one. What educational systems can do to provide teachers with the opportunities to grow as professionals and to engage in a sustained way with their students? Are the politics of hiring and the politics of career advancement well adjusted to the needs of providing learning opportunities for all? And what about infrastructure? How can inequalities in access to internet infrastructure and basic digital technologies be eliminated for all? What strategies might be or may be implemented to promote equitable access to internet infrastructure and basic digital technologies for all the students? How to foster digital and media literacy? This is a point that sometimes it's not on the table, right? Because we are talking about connection, but we need also digital and media literacy to promote the safe use of digital resources. And finally, it will be also important for researchers to consider how digital technologies can be used to improve learning for all. It's not only access, it's not only literacy, it's also the technology and the pedagogies needed in order to use this technology well and effectively. So recovery means improving the lives of the most vulnerable. And for this, it requires solidarity and innovation. If recovery efforts do not seek to include the most marginalized, we will fail as a society to build a better future than the one, to build a better world than the one we had at the outset of the pandemic. Most importantly, I think it's important that we stress this very objectively and very openly, that research is needed, but also an integration, disposition to consider how this research will be used by the government, or can be used by the government, in which ways they can be appropriated in the real life they navigate, in the real limits and the real constraints the governments navigate. It's a point that I think it's worth making in all this effort. And if we do not do so, I think it will be very difficult to prevent or to build a sustainable future that might prevent disasters as this one to happen. So thank you very much for your attention, and thank you for having me in this conversation.
It's up to us, Professor Almeida, to thank for your very inspiring contribution to this debate. Well, I must say at this point that we have many more questions than time to address them. So we are almost running out of our time. So I'll invite both Professor André Brunoni and Professor Almeida to open their microphone and screen for us to try to address the many questions that come from the audience. I'll try, as we have many more questions than time to answer them. I'll try to summarize some of them, and also address a clarifying question for Professor Brunoni, coming from Mr. Kandanamula. I'm sorry if I mispronounce your name. It's coming from the National Science Foundation from Sri Lanka. And the question is about your study on mental health, and asks whether the study focused on the online learning of children at school and their mental stress. Their experience in Sri Lanka is that it could be, this experience for students could lead to a lot of stress among young children. I think Professor Brunoni and Professor Almeida, that they had, they let's say, listed themes they think are more important and more critical for the, let's say, Brazilian social science community. But in some of the questions had already addressed this question, but I will try to summarize the questions we have on 3 lines besides the priority themes you would list as more important. And a number of questions ask if you think that the pre-pandemic time affect both the effects of the COVID-19, but the research as well. How, if you identify that there is a kind of anti bias in the research, either on mental health and education, the research community has to take into account when, let's say, designing their research projects. A second line of questions ask you which kind of research study would improve either education on mental health research agenda, meaning it's less related to the theme and more related to the study strategies researchers should design. And third, a number of questions ask you whether you think that research, academic research, can indeed help to advance the goals, your policy goals you're mentioning, and particularly the UN policy agenda. So as we almost running out of time, I would invite you to answer all these questions in 5 minutes and 5 minutes, and also include your final considerations. Who is first?
Maria,
yeah.
Please go ahead.
No, please go ahead. Please. Go ahead.
Okay, so I tried to summarize a little bit. So first, the question specifically about our study, the ELSA Brazil study is done in people who have on average 60 years old. So it's almost an elderly cohort right now. We did not get data from younger people. Worldwide, there is indeed this observation that younger people have suffered more with mental distress and mental burden than older people, maybe because of economic vulnerabilities or because they cannot fully comply to the quarantine measures. Another important topic is that being, for instance, a mother and working simultaneously at home, so there is this double burden especially for young women. So this we have observed. I would say that designing our studies was a challenge because we had to do, especially at the very beginning, we had to do everything online and then adapt it to this world of working at home or of bringing your computers at home and then doing online meetings and this type of thing. But later on, it became a more automatic process, so to speak. I would say that in some cases it was even, I would say, interesting and even more scalable to, for instance, sending out questionnaires to large number of people. In some cases, this is even faster and more affordable than asking people to go to the research center and responding to questionnaires. So maybe this will be a lesson for before the pandemic, that many things we can do online, and then we learned how to develop this type of tool. Of course, then there is the issue of digital illiteracy. So people who cannot use or cannot answer online questionnaires, either because they don't know how to do it or because they don't have access. This is a very big problem, and I would say that it's always a shadow area that we cannot really know what's going on in these people. So that's a very difficult challenge for us. I would say that on the other hand, this one would be research priorities for 2021. So thinking about study designs in mental health, I would say that first we could think about cohort studies. So cohort studies, as we are doing, for instance, surveilling populations or and populations around the world, especially more target cohorts might be interesting. So people who are more vulnerable to develop mental disorders, and also trying to identify these risk and resilience factors. And I would say that there is also an opportunity to do some type of implementation science, to do randomized clinical trials in this type of design. So for instance, one example, we can think in many examples, but one example is, for instance, identifying people who don't want to adopt, for instance, don't want to use vaccines, understand why they don't want to use vaccines, and maybe because they have like some kind of belief or bias, and then you randomize people to receive knowledge about what vaccines do, about the side effects, about risks, and then you can see if this type of intervention works or not. So this could be an opportunity for randomized clinical trials. So I would say that these approaches would be interesting, and especially because you can do virtually online, and then you do not expose your staff and to the risk of having COVID, for instance. And my final words, to keep in 5 minutes. So it was a pleasure to be here, to be invited to this meeting and talk a little bit more about this fascinating topic. And feel free to send me questions that you might have after our discussion. So thank you.
Professor Ana.
Thank you for the questions. I think those are very important questions, and I would say for the first one that was that touched this idea, what kind of research can be done and should be done now? I would say that it's research as usual, but with a concern with implementation. So this is not the usual, right? So it's research as usual, but not research as usual. Usually the researchers stop short of providing recommendations. And when they provide recommendations, those do not take into consideration the real constraints faced by governments in terms of law, what they can do, what the law allows them to do and does not allow them to do. In terms of resources, to say just to mention the two most obvious ones. So I believe that if we are embarking in a mission or embarking in a mission to support change based on research, and if we are willing to to put research to work to this end, I think it should be important to take the extra step of trying to identify how to do it. It's not only making a list of recommendations, it's using this, the tools and the knowledge of the science of implementation that will help with methodologies to identify opportunities, to identify possibilities, and also to identify obstacles that I think if we integrate that, if it's possible to integrate that in the research endeavor, I think we can have a chance to really make a contribution at this point. I'm not saying that the other research does not make contributions, right? I'm just stressing that research with a mission, research or mission-oriented research, as in the vocabulary of this call, is something that requires a different set or another set of abilities and also intentions, and this should be understood and acknowledged. I think we are a generation, or we are the product as a society. I think we are the product of the good and the evils of research, right? In our knowledge society, research has been an important and although sometimes scary, right, a tool by which we have achieved what we have achieved, acquired, or we had access to benefits, and we have access to also many improvements in life. We cannot disregard that. And we have known for a while now that this happens, although or despite of the dangers and despite of the disappointments, despite of the non-fulfilled promises, right? We are still here. And I think since this is a seminar promoted by FAPESP, this agency that has been supported by the people of São Paulo for so many years, we have a belief that research can help us. It might not give all the answers, but certainly will help us to be in a better place in the future. At least this is my wish. Thank you.
Many thanks, Anna, for these inspiring words, and many thanks for the audience for being with us today, and Professor André Brunoni and Anna once more for collaborating with us. Just two reminders before closing this webinar. This webinar is recorded in the FAPESP channel at YouTube, so you can watch and will be available as soon as we finish this event. So you can watch the event again or suggest your colleagues to watch them, so watch it. So it will be available just now, and also the call guidelines is already available at the FAPESP website, so you can get information about this call right now again. So thank you all, and we expect to meet the audience in our next webinar. Thanks a lot.